Well, you've just listed out very quickly there some strategies for dealing with it. When you do get buy-in for a proactive approach to burnout, what are some of those strategies you'll go into? You mentioned them very quickly, some things there, but what are some strategies you use to deal with this issue when you get buy-in?
So again, I'll refer to my industry, but the same blueprint or roadmap can be used by any business or any industry. And that is, you have to survey your workforce annually using something like some tool that has scientific accuracy and validity and repeatability, and has a record of comparison that you compare your data to. So if we consult on a hospital, for instance, or a large medical group, we would go in and do the mass-like burnout inventory and give that instrument to every employee. It takes about 10 minutes to fill out. The results are blinded, so nobody, feels like, they're going to say something, or their responses are going to come under some sort of scrutiny that might garner them some sort of negative impact. That doesn't happen because it's group reporting. All the results are reported in aggregate. So then you find out, that will tell you how burned out your organization is compared to similar organizations. Then you apply the mass-like areas of work-life survey to see where the negative impact is on those 6 underlying drivers. And then you present that data, we present that data, and then comes the working group or the working session where you pick the worst 2 underlying drivers and say, okay, what can we do or increase control? How can we decrease lack of control? What changes can we make in the workplace? I'll give you an example. One hospital, it took the provider somewhere around 15 or 18 clicks to get to his landing page within the electronic health record system. It should take 2 at most, maybe 3. It shouldn't take 15. And so that was an easy fix that could be done, and it can have immense return because people don't feel like they're spending most of their day just trying to log in to the computer system to find their particular landing page. So you get everybody in the room because all of the expertise, all of the experience, and all of the knowledge about what the problems are already in the room. I'm an outside observer. I don't know how things work in hospital A or hospital B or hospital C. And so once we identify the underlying drivers, we sort of have brainstorming sessions. What can we do to decrease the negative impact on these 2 worst underlying drivers? And then you make some changes in the workplace. You put some different policies or procedures in place to reduce that negative impact. Then you wait some specified length of time, then you resurvey and see if you move the needle. And this should be an annual thing. Just like we tell people to go to the doctor once a year and get a checkup, businesses should get this kind of checkup every single year because employees come, employees go, the conditions on the ground change. So the negative impact on those underlying drivers may shift. And if you improve these 2, well, what's next? What about this one over here? It got a little worse this last period. Let's work on that one. And so you do this annually, and it's not expensive. It can be done very cheaply. The instruments, you can buy them online. You can survey 1,000 people with 3 group reports for $3,500 to $3,700. 1,000 people.
Mm-hmm.
That's not expensive.
No.
Especially some of the coin that businesses drop for seminars and, things that have proven to be ineffective. I think it's time they start spending some time and attention and resources on things that have proven to be effective.
Well, you mentioned 5% are proactive and 95% are not in this area. And I agree with you. Probably that translates through our community, through businesses.
Right.
Where does this change? I mean, how could or should an HR team approach this? I mean, What's the drivers there?
Who should approach it?
Yeah, I mean, how does a company turn that around? I mean, obviously, leadership needs buy-in.
Okay, first there has to be a willingness to change. I don't know who said it, but if you want some things to change, you're going to have to change some things. And so, just becoming willing, a little bit of education. There's a great book, by the way. Christina Maslach wrote it, called "The Truth About Burnout." It tells companies and individuals what burnout is, what the underlying drivers are, and how to address them. And so it usually takes somebody to sort of push the ball down the field. You need a champion in an organization. The National Academy of Medicine in America has recommended that all large healthcare systems hire a wellness. Just went right out of my head. Director. Thank you. Yeah. Wellness director and give them a mandate and a staff and a budget and some authority, and let them begin to address this thing we call professional job-related burnout in real terms.
It's good to hear that a piece of research like that Maslach research has stood up to so many years of scrutiny. And probably more relevant today than when it was first drafted all those years ago.
Sure, and if you get a group report, you can. There's a clearinghouse of survey instruments, if you will, called MindGarden. MindGarden.com. You go to MindGarden.com and look out Maslach burnout inventory. It will pop up, and for an individual report where the person's name is on it, and you get an individual report. It's like 7 or 20. You can get a combination Maslach burnout inventory and Maslach Years of Work Life survey for like $20. If you get a group report where you've got a big group of people and the names aren't shared, it's aggregate data. It's $3 a person. So it's very cheap. And in that report, it will compare your group to 33,000 other healthcare personnel across the country. So you know where you stand. If you're better off than that comparator group, if you're the same, or if you're worse off than that comparator group. And so they've amassed this data over decades. And so they've got a tremendously large database. And now they're starting to break it out. It was healthcare providers like MDs, DOs, PAs, nurse practitioners, that sort of thing. But now they're starting to break it out into radiologists and cardiologists. And, and they also have the Maslach burnout inventory for social workers, and then the general public. So there's 3 of them. There's one for healthcare providers, social workers, because it's a different crowd, and then the general public. And so these tools are sitting there. They're just tremendously underutilized.
Yeah. I mean, I think the statistics tell us that, you said 90% of burnout comes from the workplace. And right. I think Gallup did a recent survey showing that leadership, not surprisingly, I guess, was a major source of stress, or perhaps they could have added lack of leadership.
Yeah, and you have to be careful when you're talking about burnout mitigation. The last thing you want to do, if you've got work overloaded employees, the last thing you want to do is give them additional things to do. What you want to do is unburden them from some of the rules and regulations. And oddly enough, COVID or the pandemic has served to point out for a lot of businesses that people can work from home and can be productive doing it, if they're managed properly. And so a lot of people have rediscovered their joy for work, if you will, because they don't have to fight traffic for 45 minutes in the morning and and then worry about where or what they're going to eat for lunch or how much it's going to cost, and fighting the weather, and then 45 minutes back home in the evening. And so they've freed up an hour and a half of their day just in transit. And so that should give businesses a little inkling that, hey, maybe what we're doing now and the way we're doing it is not exactly working well. So maybe we should think about doing it some different way.
And it has done that, hasn't it? It's legitimized work from home, which was always seen as a very soft option. Oh, come on, you're not in the office where we were all working. It's actually legitimized that.